Welcome to Insights, everyone. I'm Nnamdi Odikwo. The global health emergency COVID-19 has impacted hugely on the health sector, so much that we have witnessed the shifting of massive healthcare resources, mostly to COVID-19 response efforts. How that affects other healthcare delivery services, for instance, routine immunization, is part of what we intend to talk about on this episode of the program. Flooding is another clear and present danger for several states in Nigeria. We will attempt to get some updates on the situations in some states. Elizabeth Omori is here as usual, and she's set for our segment. Elizabeth?
All right, on the media review segment this week, we're also toeing the path of health. We'll be taking a look at primary health care, how to reposition it and ensure that the people get qualitative health care services.
Indeed, very well. Let's get started. Immunization is the core health service that should be prioritized for the prevention of communicable diseases and safeguarded for continuity, even during the COVID-19 pandemic. To speak to this issue, I have joining me the Chief Executive Director, CEO, National Primary Health Care Development Agency, Dr. Faisal Shoaib. Welcome to Insight.
Thank you for having me.
I will begin with a very basic question, perhaps a confirmation of the true status of routine immunization under COVID-19. I know that at the onset of the breakout in Nigeria, people were advised to only visit the hospitals for emergencies. Please confirm whether or not routine immunization services were permitted at the time and were indeed delivered in hospitals across the country during the emergency regulations.
Right. The guidance that we gave the general public was that in spite of the COVID-19 outbreak, that parents and guardians should actually take their kids for routine immunization services. So we actually sent out a public service announcement emphasizing that despite the restrictions, because of how important it is for kids to get their vaccinations, that parents should actually continue.
Can you tell us how immunization delivery strategies have been adapted and are currently being conducted under safe conditions without undue harm to health workers, the caretakers, and by caregivers, I beg your pardon, and by extension, the communities?
Right. So what we did from the get-go, once we realized that there was a chance that there will be community transmission of COVID-19, we quickly pulled together our trainers, and we did virtual trainings of healthcare workers at the national level, stepped that down to the state level, and then at the LG and community level, we did some in-person training. So in the course of the first few months of the COVID-19 outbreak, actually we trained over 200,000 primary healthcare workers. This is what provided them with the skills, the knowledge to understand how to manage the COVID-19 outbreak. First, in terms of making sure that they reimagined the spaces within their health facilities in a way that ensured that there was triaging, that is to say, identifying clients that have symptoms or signs that are suspicious, that sound or appear to be that of COVID-19, making sure that they do not come in contact with the general population, and then making sure that these were well treated or managed in a way that was respectful, that was dignifying, so that people don't feel stigmatized, and then making sure that there was a referral to the disease surveillance and notification officer. But beyond that, as part of the training, we also made sure that the health workers had the equipment that they needed. So we provided the face masks, we provided facilities for them to wash hands and also to sanitize. And then, by providing this type of equipment and also the environment, the health workers felt pretty much more confident that they'll be able to provide the services, and also the clients felt more comfortable. So we started from a situation where people were concerned or afraid of going to the health facilities to a situation where they felt a whole lot better. So we looked at the data, and we saw that in the months after the imposition of the lockdown, that there was a decline in access to routine immunization and other primary healthcare services. But by the time we finished the training and there was a lifting of the lockdown, we found that some of these services are now beginning to move on the uptick. So there's a gradual improvement in access to these health services.
Very well. In most cases, there are calendars for national immunization, even though most states have their own peculiarities. What guidance are you currently, you now as an agency, are currently giving to member states on how best or what best steps to take to mitigate the impact of the pandemic on other vaccine-preventable diseases?
Yeah, the great thing about the COVID-19 outbreak is that we've learned on the job from a situation where we were ultimately, clueless about what it was all about, apart from what we read in the papers and on the media. We now have a better understanding that the COVID-19 outbreak does not mean that everybody is going to catch the virus and everybody is going to be sick and people are going to die. Yes, people are dying, and of course we understand that there's been, maybe 1,000 or so more deaths than are necessary. But in the course of all of that, what has happened is that we have been able to do risk communication in our collaborations with agencies such as the NCDC, the Federal Ministry of Health. The PTF has been very, very, supportive in terms of allowing us to carry out our mandates. Now, health workers understand that they need to continue the services, but do these services in a way that safeguards their health. And the Honorable Minister of Health, Dr. Osage Ihanire, has been, up and proactive in making sure that that communication goes out, that, yes, the services must continue, but they have to be contextualized in a way that fits the different conditions of the state. And this is why we've been working with the Nigeria Governors Forum, we've been working with our governors, with the commissioners, with the executive secretaries of primary healthcare board to make sure that even as we provide a general national guideline, that they have the wherewithal, they have the opportunities to customize and contextualize these guidelines to their local situations.
Very well, again. So you already preempted my question. As a matter of fact, we do know that as an agency, you preempted preparations for community transmission of coronavirus. I do know that you carried out trainings of caregivers and personnel at primary health care centers across the country. In fact, you mentioned the data, you mentioned the number, about 200,000 of them, as a matter of fact. I am, however, worried about the medium used for the training and whether or not you got the desired result. It was a virtual meeting, like you said, and I know you can understand, I can understand that considering the times. But then, are you sure the right messages were passed to the trainees, considering the fluctuating nature of ICT connections across the country? And do tell, what are the feelers you got in the immediate aftermath of the training and over time?
Right. I mean, Nnamdi, you're absolutely right to be suspicious of any virtual training because this is something that we've never done right in the past. But
it was the first time. As
absolutely right. So they said there's always a first time for everything, right? And the lesson that we learned from that is that, if we do not start, how else are we going to be certain that our healthcare workers will be prepared to provide the services for Nigerians? So as an agency, we took the first leap of faith and we trained people at the national level completely using virtual means. We used webinars, we used Zoom, and after training them, we conducted a post-test. So there was a pre and a post-test to assess, to evaluate if there was learning, right? If at all people were able to get it. And we had a benchmark of 80% as the pass mark, right? So with this, we did exactly the same thing at the state level to make sure that there was understanding. Now, when we got to the LGA level and the community level, we're well aware that there will be challenges with people having networks and people understanding how to use the equipment. So in those instances, what we did was to get large classrooms, observed social distancing, making sure that every participant and the trainers also had face masks, and there was sanitizing on the hands. So that was possible at the lower level. But in each of these levels, we made sure that there was a pre and a post test. And for those who scored below 80%, we made sure that they were trained again and retested. If they're not able to make the mark, then they are dropped and other people were trained. So at the end of the day, we were pretty confident that from a knowledge-based level, we've been able to communicate exactly what we wanted them to learn. But we have also, as an agency, gone to the field to monitor the level of compliance and to also mentor, do on-the-job mentoring of all of the people that we have trained to make sure that they are also doing the right things, even at the community level, making sure that from one community to the other, even if the medium of communication, the languages might be different, the messaging is consistent across. The risk communication is consistent. I've been working with the traditional leaders in our communities to make sure that we have that consistency in terms of messaging. The blueprint is now being replicated in other West African countries because we were the first country, we were the first agency to produce the preparedness and response plan at the primary healthcare level, but we also went ahead and produced guidelines, tutorials, and training documents that other West African countries, other African countries are now, borrowing from us. They've been calling us to ask us how we did it, and we've been providing them with that kind of information. So we're really, really excited about how we've been able to use a challenge and changed it into really an opportunity to train not only on COVID-19, but it was the first opportunity in a very long while for us to train primary healthcare workers at the operational level on basic primary healthcare practices, how to treat patients with compassion, with dignity, with respect. We've not done that in several decades. So to be able to train over 200,000 primary healthcare workers in one fell swoop over the course of 3 to 4 weeks, it's been an amazing journey.
In practical terms, how has that translated to boosting confidence in service delivery at primary healthcare centers? Of course, I know you have your people on the ground and you've been getting feelers. And at the onset of COVID-19, there were fears like we've talked about at the beginning. But has that changed? Has the perception changed? Are people now coming to healthcare centers, confident in the quality of service that they will get or could get, and without also, of course, the fears might still be there, but has that reduced substantially?
No, absolutely. It's like night and day. At the beginning of the pandemic, there were instances where, community members will say, I will not even go to, say, Gwagwalada at all.
Exactly. Just
because there's an isolation center in Gwagwalada. But right now, what we're saying is that community members are now more relaxed. They're saying that even if you contract COVID-19, it's not a death sentence. President Muhammadu Buhari has been very, very clear, very strong in his support of the presidential task force. He has urged all Nigerians to obey and follow the guidelines of the presidential task force. And part of these guidelines, as clearly and well articulated by the Honorable Ministers of Health during their press briefing, is the need for these routine services to continue. And because of that clear communication, what we have seen from the data is that from March, there was a decline in routine services, routine primary healthcare services. But from the month of June, we're beginning to see that decline has now reversed. We're seeing an uptick. We can see now from the data that people are now beginning to come to the health facilities and access care. So there's a direct link between the confidence that has been provided by the Presidential Task Force and also the training that we have given to primary healthcare workers that has now, imbibed in them a confidence that they are able to protect themselves and also protect their clients from COVID-19. And that is what they really needed. And of course, the fact that the governors, the commissioners are actually providing the equipment, that really helps. The PPEs, the personal protective equipments, sanitizers and all of that guidelines, that has really helped in no small measure to boost the confidence of health workers that yes, they can manage routine services even in the face of COVID-19.
Dr. Shuaib, we know that pre-COVID-19 we had very serious issues with maternal and child deaths, and we're working continuously towards strengthening primary health care, again towards achieving universal health coverage. Subsisting challenges inhibiting progress towards the goals we may have set are now exacerbated by COVID-19. What percentage of Nigerians have been captured pre-COVID-19, and how do you expect for indigent members of our society or communities, for instance, to choose between healthcare and other daily expenses like food, clothing, and even housing? Do you think that can come easy, especially with COVID-19, especially at rural communities, that level?
Yes, this is a struggle that every Nigerian has to live with, especially with the majority of Nigerians who live below the poverty line. So this is why the Basic Healthcare Provision Fund is transformative, right? This is a fund of an average of about 55 billion naira that President Muhammadu Buhari has, assented to, that is being released by the Federal Ministry of Health. This is targeted towards universal health coverage. At the end of the day, because of the Basic Healthcare Provision Fund, the Federal Ministry of Health, working with the National Primary Healthcare Development Agency, with the National Health Insurance Scheme, will be able to provide funding for basic health services in a way that when Nigerians go to primary healthcare centers in the next few months and the next few years, they will not have to pay out of pocket. Catastrophic expenditures on health services will now be a thing of the past. This is within the milieu of the COVID-19 and all of the challenges that it brings. So we're very optimistic that over time, Nigerians will be able to afford basic healthcare because the federal government, working with the state government, has been able to make these funds available, even outside of the budget that is made for primary health care in the states. So we are really, really optimistic that this will transform the primary health care space.
We're actually out of time, but before I let you go, one very quick question. Most agencies, even humans like us, we have a priority list where we put our agendas, and we probably choose either from the top or the bottom. And as an organization, as an agency, for you, what is at the top of your priority in terms of short, medium, and long-term targets?
Right. It will have to be that we have to cut down on the numbers of women and children under 5 that are dying from preventable causes. We have to increase the quality of primary health care, have increased access. But in the end, long term, we would like to achieve universal health coverage so that wherever Nigerians live or work, they'll have access to basic quality primary health care services that improves their health.
Dr. Faisal Shuaib, thank you, Executive Director, National Primary Healthcare Development Agency, and of course, CEO of the same agency. Thank you so much for coming on Insight. It's been a pleasure talking to you on these matters. We would look for time to bring you back on the program so we can talk some more on these issues. Of course, these issues are still in play, and we should be able to revisit them sometime real soon. Thank you so much for coming on Insight.
Thank you very much for having me.
Next, we take a look at how flooding in various parts of the country is wreaking havoc and causing further hardships on people already burdened by the impact of COVID-19. Almost every region of the country has witnessed massive flooding, displacing thousands, damaging livelihoods and threatening our national food supply. Let's get a sense of how serious the issues are. Sani Dododo is the chairman, Kebbi State Emergency Management Agency, joins me from Birnin Kebbi. Emeka Obinwa is also with us. He is the Executive Assistant Media to the Anambra State Governor on SEMA. He joins us from Awka, Anambra State. Gentlemen, welcome to Insight. I'll just go ahead with the chairman, SEMA Kebbi State. Can you give us a sense of how massive the damages are in your state?
Yes, exactly. Kebbi State is really affected by massive flood because most of the local government are now submerged. That is the Fadama area of Kebbi State of about 600 kilometers was submerged by flood because right from the Birnin Tudu in Abuja local government, which is bordering Sokoto State, down to Tuga Bridge in Bagudo local government, also in Kebbi State, which cover about 350 kilometers. That is the river Bakalori submerged. And then for the Tuga Bridge in Bagudo local government, in Geske local government, which is very close to Kanji Dam, bordering charging point of this water is about 250 kilometers, is also submerged. So even the focus given to us earlier by the National Emergency by NIMET,
Yes.
that about 11 local government out of 102 Nigeria, Kebbi State is expected to have 11 local government. Now, almost all the local government in Kebbi State are now affected by this flood. There is no local government in Kebbi State which is not affected by flood, as at this material time I'm talking to you. So, honestly speaking, it comes to the extent that this year, all our farmers, be it retired civil servant, service civil servant, peasant farmers, and even large-scale farmers, everybody engaged in farming this year. But all what has been planted, especially rice, is now submerged by water here in Kebbi State. So honestly speaking,
that's quite unfortunate because Kebbi State is known
Kebbi State is really, have a problem. Yeah.
Yes. I was just saying that is quite unfortunate because we do know Kebbi State for rice cultivation. How has that affected this year's planting season for rice?
Well, I think this year's rice, honestly speaking, we have to go back for the dry season farming. But the wet season farming, which is a period now, there's nothing we can do about it. It has been taken by the flood. But His Excellency, my governor, and even this our agency, and even the federal government, now put head together. You see, recently the Minister of Agriculture visited Kebbi, and then we are putting head together to see what we can do to go back to the dry season farming immediately after the water has recessed. But as at now, there is nothing, no hope about the rice farming season in Kebbi State at this material time.
Emeka Obinwa, this is an issue that should be, quite relatable for you, because I do know that in the Anambra East and West axis of Anambra State, going from Ayamelum to Anam and some riverine communities, Ogbaru and others by the river bank, by the river Niger. These are communities that year in, year out get submerged, by flooding. This year, that hasn't happened yet. But what are we hearing? What are we seeing on the ground? is there growing fear that communities might be submerged again, going by the forecast coming from NIMED and other agencies? Are the people living in fear already in anticipation of what might come?
Thanks, Nnamdi. Going by the predictions of the relevant agencies, the NISA, Nigeria Hydrological Services Agency, and NIMED, there is this fear that more local governments will be submerged this season because they predicted early rains from February that will last till late December this year. And going by the prediction, they added some local governments that hitherto are not affected by flood. Some of these local governments are the upland local governments like Njikoka local government, like Idemili North, and others. So we are taking into account of the impairment, and that's why the State Emergency Management Agency has already heard of its sensitization program to all local governments and communities along the flood-prone areas in Anambra State.
Okay, how worried are the rice farmers around the Ayamelum axis and Ayamelum, Anam, and Ogbaru axis, where the areas popularly known for the planting of rice, for rice cultivation? Are there fears from that area as well?
Yes, there's this palpable fear that their efforts in planting some of these food crops will be nullity. And it formed a sensitization message that they should start early to begin to harvest their farm products so that they are not submerged when the flood comes.
It's a good thing that you've brought up the issue of population awareness and preparedness. I mean, it's one of the proactive flood control measures besides other proactive measures. I mean, since you said that that has already begun, what feelers are you getting from communities previously impacted, and how has that helped you to perhaps prepare your message, and is that helping to change minds in communities? Are you perhaps thinking of relocating people earlier from communities previously impacted, just to circumvent or just to, mitigate, or rather, to preempt whatever might be or might happen if the flood does come?
Yes, during our sensitization campaign, we advised them to be prepared, just like the Scout mantra would say, be prepared. We asked them to pack their belongings, their important belongings, their medicaments, clothes, certificates, and other, so they are very, very useful to them, and get them so that at any point in time they are asked to leave, they will just pick them and then vacate.
Okay, that's good to know. I'll go back now to...
Yes, it formed part of the message, but, the people received this message with mixed feelings.
Okay.
Some said they were not going to move because they are in tune with the, with the nature in that place, that this has been happening to them. They're not going to move. But in this circumstance, we have to use persuasion. We have to advise them on the need in order not to lose life. Because life first in everything you do. Life first. So we use persuasion, ask them to move. So those of them that would heed to the advice are evacuated to holding centers, the state government, through the benevolence of His Excellency, the Executive Governor of Anambra State, Chief Dr. Willie Obiano, has, in his wisdom, approved some funds to make sure that all these holding centers are made habitable for these flood victims, and it starts coming.
Okay, thank you. I'll go over now to Sani Dododo in Brennan Kirby. Well, we as part of we do know of the other long-term measures, you know, preparatory measures. But let me take you up on the issue of population awareness and sensitization of the populace, especially in some of these areas impacted by flooding now. I mean, how much of a campaign did the state government, in fact, did your agency, SEMA, carry out in some of these areas? And did you succeed in moving some communities away before the floods submerged them?
Well, exactly. Immediately we received the signal from the NAMIT that about 11 local government are going to be affected. We immediately summoned the meeting of all the chairmen of those local government, including the traditional rulers and even the Commissioner for Local Government and Chieftaincy Affairs in Kebbi State. We intimate them that flood is imminent. They have to go back and start sensitization. There are people in this local government mentioned earlier. But when we discovered that it has gone beyond that, we also invited all the 4 emirates in Kebbi State, that's the stakeholders, including security agencies, religious leaders, and traditional rulers, and even the paramilitary and even the military. We sat down with them. We said, please, gentlemen, you go back and try to avail and start informing people about the danger of the flooding here in Kebbi State. And know fully that Kebbi State is just like a valley. And if you look at the geographical position of Kebbi State, it is like a valley. And then all the 2 dams, that one in Gorenyo, the other one in Bakalori, are now discharging water in Kebbi State. And then the Dolake Agazis, which is the local government, which is bordering Niger Republic, also the water for in Cameroon and the Niger Republic are also discharging water in Kebbi State. And then we have what you call about Zampara, that is the Agazis of Gumi and part of Shagari in Sokoto State, are now discharging water also in Jega local government area, where we have the capsize of boat. Last time when we lost about 10 people, 8 people that were able to to rescue 2 people out of 10, but all the 8 has died. And then by knowing the position of our state, we vigorously embark on sensitization for our people to be relocated to the higher lands so that life and property should be safe. But when the water comes, with all the effort and consideration, we are dealing with the nature. There's nothing you can do about it. But all the same, His Excellency, the executive governor of Kebbi State, Senator Abubakar Atiku Bagudu Motola Ngwandu, has gone around himself, including the official of my agency. We have gone around day and night, going and sensitize and even try to relocate people to the offland or to the higher land. Now, in Kebbi State, we have so many, IDP centers, where we relocate people, most especially at Bagudu local government. And now we have highly 50 risk local government where we have the flooding seriously. And even the offland local government are not affected. But what we are doing now is that we have 2 problems at hand. One, collapsing and demolition of the houses by water, and then the flooding. So flooding of farms and even the houses of people in the villages and the communities are also affected by this flood. So we have a serious problem in Kebbi. But we are still embarking on sensitization and even electing people through radio, television, the town criers, and even our traditional institutions during a ceremony, naming ceremony, wherever we have a little gathering, we try to sensitize our people about this problem of flooding. So in terms of sensitization, we are doing everything humanly possible to educate our people about this flooding here in Kebbi State.
Okay, so I understand that most primary schools in Argungu have been converted into shelter for those displaced by the flooding. We're in a period of the pandemic, was still reeling from the effects of the pandemic. What is the state government through SEMA doing to ensure that these displaced persons, do not,
nine designated. We have about 9 designated centers where we, locate people in Argungu town only.
Okay.
So if you take the whole Argungu local government, we have about 15 to 25 IDP centers.
Okay, but my question really isn't on the center. I'm more concerned about the welfare of the people. What are you doing to ensure that, they don't suffer much more than they already are owing to the flooding? There's COVID-19 on the one hand, and now they have been displaced by the flooding. What are you doing to ensure that, they get some sort of relative ease, from the tension and pressure, as it were? Did you get my question, sir?
So what do we normally do when we have this problem? Well, we immediately, jointly with
Okay, we seem to be having some issues with Sani Dodo's connection from Benin Kebbi. I'll move on over now to Emeka Obinwa.
All the people who are relocated.
I'll move over to Emeka Obinwa in Awka, Anambra State. Are you still there? Great. Okay, so
yes,
year in, year out, like we talked about earlier, we get flooding in parts of Anambra. As a matter of fact, in some cases, even in the state capital, we experience flash flooding in Awka, the state's capital. What are some of the factors responsible for these, and what is the state government doing to ensure that it doesn't happen as it has happened in previous years?
One of the major problems is that people build on water channels, on drainages. And again, people emptying their refuse They have been pulling down houses that are built on flood channels. They have been on air warning people to desist, to stop from building on flood channels, on drainages. And they have been pulling those houses down.
Okay.
The Minister of Environment had engaged the workers to begin to clear the drainages. Even they have extended this invitation to local governments to make sure that all the drainages are desilted and the refuse are cleared so that the flood water will have easy way down to the channels.
Emeka Obinwa, I'll get your final words now that I have you before I move over to Benin Kebbi. What are your final words on the program as we look ahead and look forward to better times? A time when flooding would not displace, especially indigent members, from their communities.
Well, I will advise them on behalf of STEMA to be prepared, to be evacuated when the flood comes. Thanks to His Excellency, the Governor of Anambra State, Dr. Willie Obiano, for making funds available to make sure that these holding centers are made habitable, are cleaned and fumigated to make sure that the flood victims are housed in these holding centers, that they are comfortable and they don't suffer unduly because of flood attack when it comes.
Thank you so much, Emeka Obinwa.
The situation.
Okay. I'll just move over now to Benin Kebbi, where I have Sani Dododo. Is he still there? If you're there, I would like to get your final words. You were speaking earlier to the issue of efforts being put in place to alleviate the plight of persons displaced by flooding in Kebbi State. And can you just quickly take that as your final words, please?
Well, I think I have to thank my governor, His Excellency, the Executive Governor of Kebbi State, Senator Abubakar Atiku Bagudu, by providing adequate fund for the agency. And not only that, His Excellency released fund to all the local government in order to also complement the effort of the agency, that is our agency, SEMA. His Excellency is always also making money available to his wives also to go around with her project to see what she can do as a medical doctor to assist the younger ones to provide medication. And on one end, we provide medication, food items, mosquito net, mosquito coil, even cooking pots and even firewood for all the displaced person in order to cater for them to be protected and provide and to make environment, enable environment for them so that they will feel like government is with them. And not only that, we are visiting them from time to time together with all the officials of the local government, director, social director, works, and director, who are our desk officers, so that we have contact. Even our emirs and the traditional rulers, religious leaders, we jointly together, and we have a task force where we have the local government committee on SEMA going around to sensitize and even taking care of all those people, providing security, toilet facilities, and food items, and even the medication. So, we also have, I want to use this opportunity to thank Mr. Single-handedly for issuing a statement about the issue in Kebbi State through his media aides, and also the Minister of Humanitarian, Hajiya Saidiya, also for even mentioning my name single-handedly and the Sema Kebbi State for our effort to cater for our people at this period, at this testing period.
Great.
So, I have to thank you.
We're out of time now. Sani Dododo, Chairman, Kebbi State Emergency Management Agency, Meka Obimwa, Executive Assistant to the Governor, Media on SEMA. I want to thank you both gentlemen for coming on Insight. It's been a pleasure speaking with you. Thank you so much for coming on Insight.
Thank you very much. Thank you very much indeed.
Up next is the Media Review segment.
Thanks for joining us on the Media Review segment this week. Primary health care is a grassroots management approach to providing healthcare services to communities. Various countries have attained different levels of progress. How can the government redirect resources for healthcare from curative services to preventive services in order to provide primary healthcare infrastructures, encourage the migration of health workers from urban to rural areas, and provide acceptable level of healthcare services for all, thereby reducing the gross inequality in health status of the people? These are some of the areas my guest, Dr. Jane Igali, a family physician, will critically take a look at. Dr. Jane, it's nice to have you in our studio.
Thank you for having me.
All right, you are a stakeholder in the health sector. How would you assess primary health care in Nigeria currently?
Like most aspects of our healthcare, it's implementation that we look at. Most times people talk about primary healthcare, and then there's no distinct difference between primary healthcare and the medical practice itself, like what you just said, preventive healthcare and curative. So most times we talk about primary health care, and what comes into your mind is what are we doing in the primary health care environment, the hospitals, the primary health care institutions and all that. But the thing is, primary health care, the reason why primary health care was instituted in the first place was not just because of the curative part. It was about preventive all the way. And when you want to assess primary health care, you have to assess it through what it is supposed to give that it is not giving now. And that's why when we're talking about what to do to change the effects that primary healthcare has brought to our system, we should be looking at what it is not doing yet. That is the prevention that it has not brought to the table.
Okay. All right. We understand that the Buhari administration has done so much in terms of primary health care and then has put so much attention to resources, placement of resources into the health sector. Now, there's the issue of migration, health workers' migration from the urban to the rural areas. Why is this a challenge?
Health care workers will always migrate if the environment they work is not conducive. The same thing with what is happening in other aspects of healthcare in Nigeria, that healthcare workers are migrating away from Nigeria itself to other countries. That is because the people just want a situation where they feel better taken care of, better remuneration, better equipment, and other things that they work with. Now, in the local areas, so many other things come to play. It's not just about how much the healthcare worker is being paid. We talk about electricity. We talk about access. In fact, primary health care cannot happen just by the health sector. It is supposed to be one of the principles of the primary health care delivery itself. It's intersectoral coordination, different sectors coming together to achieve the thing that the health sector is, or make it something that the effect of what the health sector is doing is reaching the people. And this can only happen when all the sectors are working together and providing the amenities that are affecting health in different aspects. Like, for an example, for a health worker to be in a local place, like you want to work in a primary health care located in a village that does not have accessible road, for an example, you would first of all think about your health traveling on the road, and thinking about health insurance for the health worker himself and other things. You look at it and, is this risk worth taking? And then you now go to the villages and realize that preventable diseases like just malaria, it's more there because the environment is not taken care of. So mosquitoes are breeding more, and so the people are more exposed to preventable diseases in those rural areas. So the healthcare workers themselves have the issues of their own health being at stake through the roads and other things. And if they themselves need health care, what are they going to, what level of health care can they access being with their families in the village to take care of other people's health? So it's not just about them migrating or equipping the primary health care center, as it were, as to intersectoral coordination of every aspect of society working. So when primary health care is not delivering what it is supposed to deliver, it's not just about the fact that we don't have essential drugs in the hospital. That is not the only thing that is affecting it. It's every aspect of society working together. That is what it is supposed to be in the first place. And that is one of the reasons why healthcare workers tend to migrate from local areas to urban areas, and very difficult for them to migrate back because of their families and their personal health too.
Let's talk about the issue of acceptance. How is primary health care accepted in rural areas? And I'm happy your specialization speaks volume to our focus.
It's supposed to be, by its definition, the essential health care that is available to them, right? But through their own participation. They are supposed to, the people in the community are supposed to be the ones accepting this health care and participating in it. For example, when you talk about diarrhea, and the management of diarrhea entails a lot of, dehydration comes in, and you would require rehydration therapy, right? Now, in primary health care, you are making both the people that have the diarrhea, like the mother that has the child with the diarrhea, participates in giving this health care. So she is participating in delivering and learning how to give rehydration therapy by herself. So if it's about acceptance or acceptability, primary health care is readily accepted because they are the ones that are part of delivery also.
Okay.
But then, when it is not understood and the patients you're treating are not participating in the primary health care, we now start talking about accepting the health care.
Health services.
Yeah, it is very, very critical, if there is any other word I can use. If the people that are supposed to be treated in 5 minutes just because the primary health care is close to them are using maybe 1 or 2 days to get to the secondary health care system, you're already exposing the population to higher risk of whatever thing that would have been preventable, you see. So if we equip the healthcare, the primary health care system, and train the personnel that are supposed to manage them and bring in more confidence in the society so they know that these things are accessible and you can be treated in these places, you know, it will bring a lot of good to the healthcare system of the country.
Okay.
It's not just about the equipment itself, like I said. Of course, equipment is necessary, but there are some healthcare, primary healthcare centers that have what it takes to take care of the people around, but they are not still assessed. So before we talk about government equipping everywhere, before people can access it, let's talk about what we can do to help the people get prevention that they can even access. Because that in itself makes the healthcare system, the primary healthcare system, at least working.
Dr. Jane, I would like to come in there. How can we reposition our primary healthcare system?
Implementation.
Okay.
Implementation of everything that government has promised the healthcare system. Community participation must be looked back on. How is the community participating in their own health? So you are not just waiting for them to say, there are no drugs in the primary health care, so I want to go to the teaching hospital. How are you participating in your own health? Because that is one of the major principles of primary health care. And if these things are not looked at, primary health care can work. And the other one is intersectoral coordination, then appropriate technology that the people themselves can use, you know, to assess and help themselves.
Dr. Jane Igali, a family physician, thank you so much for coming to our studio to enlighten us.
Thank you.
Thank you very much. And that's it on the Media Review segment this week.
And that's it on this episode of the program. Do join us same time next week for more on Insights. I'm Nnamdi Odiko.
And I'm Elizabeth Omori. Stay safe.
Anybody who is exposed can contract coronavirus, but not everybody has a fair chance of surviving the disease. Data has shown that older persons stand a higher risk of dying. Are you 55 years and above? Do you have pre-existing health conditions? Please safeguard yourself and minimize your risk. Observe all COVID-19 protocols.
If you hear of anyone with high fever, dry cough, and difficulty in breathing, please do not go near such a person because they could be a victim of coronavirus infection. Call someone else or the NCDC to assist. Please use